Once the procedure is completed, how soon does the weight loss begin?
The weight loss actually begins prior to the procedure. We like to put all patients on a liquid diet for 2 weeks. This is to shrink the liver. When I do the surgery, the liver sits right across your upper abdomen, and I actually have to lift it to go underneath it to slide the band around the stomach. Now, I've only opened 6 lap bands in 4,500, and 4 of those 6 were due to the liver. And so we've instituted a program with this quite marked calorie reduction diet to shrink the liver preoperatively. And a friend of mine in New Zealand, Rob Fries, who's a surgeon there, found that if you do a low-calorie diet for 2 weeks, you're going to lose, your liver will shrink 2 inches in length and depth. So the deal is we put everybody on the liquid diet for 2 weeks. And this is the only thing I'm a bit testy about. If you don't do the diet, and I can tell you've done it because you lose weight, I won't do the operation because I just think it's a silly risk to have to take. So the weight loss starts prior to the surgery, and then we put the band in. We leave it loose for the first 6 weeks. Patients typically lose weight in the few weeks afterwards because of swelling from the surgery, and then in the 5th and 6th weeks when they're eating a normal diet, they're usually pretty unrestricted. And then they come in for their first follow-up, we tighten the band, and they're away. So these patients then lose 1 to 2 pounds a week. And the average weight loss for the average person would be 8 to 10 pounds a month. Our average patient is a woman in her mid-40s with a BMI of about 48 who weighs, say, 340, 350, something like that. And that patient can expect to lose 8 to 10 pounds a month. And it's really awesome because usually around a year they've lost between 80 and 100 pounds. And it's in a year, and it's fantastic. And then it just keeps boom, 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 like this. And the average patient will really have steady weight loss for 3 years. And what they can expect is that that BMI of 48 will go down to be a BMI of 28 to 30 at 3 years. And that will be associated with a significant chance of losing all your comorbidity. 80% of diabetics will come off all their medicine, including insulin, by 2 years. Same for hypertension and cholesterol and depression and asthma and sleep apnea. And they're really the big 5 or 6 conditions that obese people who come to surgery have. And it's really fantastic to be able to sit here and say to someone like yourself, okay, Maisie, you've got all these diseases. In 2 years, you've got an 80% chance of being off all this stuff and of having lost 120, 130 pounds and really feeling great.